From viewing our site, you've probably noticed there are many terms in dermatology. Well, in this lecture, we'll be learning a little bit about some general dermatological terms. So let's learn a little bit about dermatologic terms. Well, first, if you look at our DermaLearn tool, we talk about what's the primary problem. And in dermatology, some very broad categories that we use are neoplastic problems. So is it an abnormal growth of skin tissues, such as a mole or a wart? Or is it an inflammatory process? So is it your body's response to some type of a stimulus, such as a rash or an irritation of the skin or an infection? And then we also talk about a hair problem or a nails problem. Well, let's learn a little bit more about terms. Here you see on our DermaLearn tool, we're trying to organize it into the four overall categories we're using. Is it a single growth, a neoplasm? Is it an inflammatory process, a nail problem, or a hair problem? Well, let's learn about a primary lesion. So we want to know a little bit more about what you're seeing on your skin. So the first term is a macule. So what is a macule? Well, a macule is a flat spot that is different in color from the surrounding skin. So here you see a brown macule. What about a papule? Well, a papule is a bump, an elevation of the skin. Usually it's less than about 1 or 1.5 centimeters in size. If it is larger than about 1 to 1.5 centimeters, it's called a nodule. So here you can see a skin-colored papule. What's next on the list? Well, let's talk about a plaque. Well, a plaque is a flat-topped, elevated lesion on the skin, and here you can see a plaque of psoriasis. You can see how it's thickened when compared to the surrounding skin, and in this case it has scale. So this is an erythematous or red scaling plaque of psoriasis. On to the next term, a cyst. Well, a cyst is similar to a balloon of skin trapped under the skin. So you can see in this picture the pore from which this cyst originated. And this will often be, well, this type of cyst called an epidermal inclusion cyst, this is filled with a foul-smelling substance which is exfoliated skin combined with some oils. Other primary lesions, an ulcer. Well, that is a lack of the surface of the skin, so the epidermis and sometimes the dermis are lost, and here's a good example of an ulceration. If it's more shallow, where just the top layer of skin is lost, then it's called an erosion. Other primary lesions here are pustules. It's a pimple filled with yellow liquid. Onto vesicle or bulla. So if it's a small blister, it's a vesicle. If it's a large blister, we call it a bulla in dermatology and medicine in general. And finally, depressed or atrophic. So what that means, depressed means there's a loss of the deeper structure of the skin, so it's somewhat of an indentation, and atrophy is usually used to refer to the thinning of the skin. And in this atrophic patch, we're seeing a thinning of the skin. This patient has what's called necrobiosis lipoidica, which is a diabetes-associated skin condition. A few other terms. Now we're going to talk about arrangements, or out of primary lesion, we're going to talk about how certain rashes are arranged. Well, it can be grouped or regional, like in this example of shingles, or also known as herpes zoster. So it's confined to one area of the body. Or it could be widespread, such as this. This patient has psoriasis and it's involving much of their body. Other pattern, linear, roughly arranged in a line. And annular or ring-shaped. When there are multiple rings, we call it polycyclic. So here in this patient has what's called granuloma annulare, and it is a mimic of ringworm. It's not truly, as far as we don't know the cause. It's not an infectious process, but it's not a fungus, which is seen in ringworm, also known as tinea corporis.